Kristen, hello. How are you?
I'm okay.
I looked at Jenny's X-ray and CT scan images. Unfortunately, she does suffer from a condition called craniosynostosis, which we suspected. The images show that her suture has fused prematurely.
Okay.
Babies' skulls have openings called sutures, which allow the brain to grow. The brain triples in size in the first year, and it continues to grow until they're about 12 years old. Can you tell me a little bit more about Jenny's symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her. But I was sure something was wrong. She's in a lot of pain.
Oh, I'm sorry to hear that. Jenny has the condition craniosynostosis, but her skull shape is almost normal, which may have made it more difficult to diagnose. Craniosynostosis is uncommon, so many doctors have difficulty detecting cases like Jenny's. As Jenny's brain grows, it needs to be able to push the skull bones apart, giving it room to grow. If there's a fusion of the suture, then the growth is restricted and the brain is squeezed. Intracranial pressure can be extremely painful, so I am really impressed at how brave Jenny is. She's a strong child.
That's true. Yes, she is. So, what are the options?
My biggest concern right now is reducing that intracranial pressure, and we can accomplish that with surgery.
Surgery? That sounds really dangerous. My pediatrician thinks it can be fixed with a helmet.
If the sagittal suture hadn't fused, then, maybe a molding helmet would work, but not now. Every surgery has several risks, especially head surgeries. Jenny's otherwise healthy, so that greatly reduces the risks. We'll double check to make sure that she doesn't have any heart or lung conditions, which might represent a contraindication of surgical treatment.
I'm just really concerned. What exactly will this surgery involve?
We've got 2 options. Jenny's 6 months old, so we can perform a minimally invasive procedure, or we can do the traditional surgery. Let me explain. The traditional approach starts with an incision just above one ear. We go across the top of the head to the other ear, and that's usually the only scar. It's normally hidden by the hair. After the incision is made, then the affected areas of the skull are removed. We create an opening for the brain to grow, and then we reshape these bones and return them to a normal position. Once the procedure is finished, it's usually sewed up using dissolving sutures.
Sounds really difficult.
It is. It's a big surgery. It can take up to 8 hours to perform. Craniosynostosis is very complex. The surgery involves the expertise of a number of different specialists working together. And after that, Jenny would have to be in the hospital for 3 days.
If Jenny has this surgery, do we know that she'll be without pain afterwards?
Unfortunately, there's no guarantee that the condition will be completely gone after the surgery. Some children continue to have some pain, but we can usually resolve that with medication. Some children require that there be a second surgery, but that's very rare because the success rate is extremely high. It's over 98%. We've been doing this surgery for many years very successfully.
Sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
No worries. It's very important that you ask questions, as many questions as you want. With the second minimally invasive endoscopic surgery, that's one that we normally perform when the baby is young, typically younger than 6 months. We use an endoscope to open the suture, and the surgery takes about an hour. She has to spend about 1 night in the hospital. She can probably go home the next day. After that, she would need to wear a molding helmet for about 6 months. We need to check it every 3 months to make sure that the sutures weren't closing early. It's a simpler procedure. It can be equally successful when the baby's very young.
Okay. Is the helmet painful?
Don't worry, the helmet is not painful. It would be custom made. The success of the procedure depends on how consistently the helmet is worn. And after about 6 months, we know if the growth is normal. If it's not, then we may have to perform another surgery. The second surgery would be the longer, traditional one. Both types are complex. We have to work with a team. My team includes a plastic surgeon and neurologist.
This is all overwhelming. How do I decide what's best for Jenny?
I know it's overwhelming. There's so much to consider.
So you're pretty sure she needs surgery? A helmet alone won't work?
Unfortunately, no. There's been fusion that has to be corrected surgically. Plus, if you wait a month, then the minimal procedure won't be an option. Jenny will be too old for that. We typically perform endoscopies on 2 to 3 month old babies. I recommend that you talk to some other specialists in the field because the more information you have, the better you'll be.
Okay.
I'll have my assistant print a list with the contact details of my colleagues.
Thank you. This is very stressful.
I understand. I'm sure it's stressful and exhausting. Do you have family or friends to help you?
My mom.
Oh, that's good. You have your mom to talk to give you some support. Any other questions I can answer, or?
No. This is all really helpful.
It's a lot of information, I know. Let me give you a pamphlet that has information about craniosynostosis and your treatment options.
Thank you.
If there are any questions, again, please just let me know. We'll schedule another appointment and make sure we answer those questions.